Can beta blockers improve engagement in PTSD trauma therapy? Imagine a tool that could help people facing the intense fear and stress of trauma therapy feel a little more at ease. That tool might be beta blockers, especially a medication called Propranolol. These drugs are known for their heart-related uses, but research suggests they could also play a role in PTSD treatment. Propranolol works by blocking certain signals in the nervous system, specifically noradrenaline, which is often elevated in PTSD. This reduction can decrease symptoms like rapid heartbeat, sweating, and hyperarousal during trauma recall. The idea is to give propranolol before trauma memory sessions. When a person recalls a traumatic event, their brain tries to reconsolidate that memory, making it more or less emotionally intense. By administering propranolol at this moment, it may interfere with this process, weakening the emotional charge attached to the memory. This could make therapy sessions less distressing, encouraging patients to engage more fully and process their trauma more effectively. Studies have shown that when propranolol is given before brief trauma recall sessions, patients often show reduced physiological responses, such as lower heart rates and less skin conductance, which are signs of stress and fear. These findings suggest that propranolol can have a calming effect during trauma reactivation, potentially helping patients tolerate therapy better. However, the evidence is mixed. Some clinical trials report significant symptom reductions when propranolol is added to trauma therapy, but others find that similar improvements happen with exposure therapy alone. This indicates that while propranolol may help with physiological symptoms, it might not address all aspects of PTSD, like avoidance or mood issues. It's also important to understand that propranolol seems more effective when used soon after trauma or in cases where symptoms are severe. For long-standing PTSD with deeply ingrained memories, its impact might be less noticeable. Additionally, propranolol does not directly treat all symptoms of PTSD. It is best used as part of a comprehensive treatment plan that includes therapy and other support. In practical terms, clinicians might consider using propranolol as an adjunct during trauma-focused therapies like exposure therapy. By reducing the physical distress during trauma recall, patients may find it easier to stay engaged and process their memories. But it is crucial to remember that medication alone is not a cure. Proper medical guidance and personalized treatment plans are essential. In summary, beta blockers such as propranolol have shown promise in improving engagement in PTSD therapy by dampening the body's stress response during trauma recall. This can help patients tolerate therapy sessions better and may weaken the emotional impact of traumatic memories. However, the effects are generally modest and should be viewed as part of a broader, individualized treatment approach. Ongoing research continues to explore how best to integrate these medications into PTSD care, always emphasizing the importance of consulting healthcare professionals for tailored advice.